Is closing out a tumultuous year, ranked first in the country for new COVID-19 cases per capita, with almost 6,000 new cases today. Hospitalizations are still extremely high, and 97 more people have died from this virus. Of course, the verdict is still out, but experts worry we will start seeing a Christmas surge next week. News Channel 5's Chris Davis breaks down new concerns that New Year celebrations tonight could be the next super spreader event.
COVID loved 2020. Most of us hated 2020.
Healthcare leaders have their eyes on a different countdown this New Year's Eve.
We do not have enough healthcare workers to take care of another surge. We don't have enough general hospital beds or ICU beds to do that.
To avoid overwhelming hospitals, Vanderbilt's Dr. William Schaffner says the most helpful thing to do is to just celebrate with the people you live with. But
if you are going to get together, but if you are, please wear your mask unless you're drinking or eating, and then put your mask right back on.
The last thing pulmonologist Dr. Aaron Millstone wants to see is another fashion house party where hundreds of people crammed into one space in East Nashville over the summer.
If you go to a large New Year's party, it's highly likely that somebody at that New Year's party is going to be infected.
The more people involved, the bigger risk there is.
This is a stealth virus, right? It can infect someone, not make them sick at all. They're feeling fine, but they can still be contagious.
Of course, many of you will still head down to Broadway or other bars around the area.
You really want to avoid indoor restaurants or indoor dinings for this New Year's, unless you really know the restaurant and their safety protocols.
In other words, if this new year is really about new beginnings, it should start right now.
New Year's are a time for hope and expectation for things better, and we certainly all hope for that, but they won't come by themselves.
In Nashville, Chris Davis, News Channel 5.